Hey everyone, Dr. Mike here. Today we're diving into a common issue: rotator cuff injuries. Your shoulder's incredible range of motion, throwing, reaching, combing your hair, is thanks to the rotator cuff. This group of four muscles and their tendons forms a cuff around your upper arm bone, keeping your shoulder stable and moving smoothly. The supraspinatus, infraspinatus, teres minor, and subscapularis all work together to lift and rotate your arm. The rotator cuff's main jobs? Movement and stability. It lets you raise, rotate, and control your arm, while keeping the joint secure in its socket. Without a healthy rotator cuff, even simple tasks like getting dressed or carrying groceries can become painful. Most people don't think about these muscles until something goes wrong. That's why understanding how your rotator cuff works is key to keeping it healthy. A strong, flexible rotator cuff is essential for staying active and independent. So how do these injuries actually happen? Let's break it down. Transition to next scene. Rotator cuff injuries happen in two main ways: sudden trauma or gradual wear and tear. Acute injuries can result from a fall, lifting something too heavy, or a sudden forceful pull, causing an immediate tear. More often though, injuries develop slowly from repetitive stress. Think overhead work, sports like baseball or tennis, or years of heavy lifting. Over time, tendons can fray and weaken, leading to tears. Aging is another factor. As we get older, blood supply to the tendons decreases, making them less resilient and slower to heal. That's why rotator cuff problems are more common after age 50. Bone spurs can also play a role. These small overgrowths on the shoulder bone can rub against the tendons, causing irritation and eventually a tear. It's like a rope wearing down on a sharp edge. Whether sudden or gradual, the result is pain and loss of function. Next, let's look at the signs and symptoms of a tear. Transition to next scene. How do you know if you have a rotator cuff injury? The most common sign is pain, usually a dull ache deep in the shoulder, sometimes sharp with certain movements. Pain often worsens at night, especially if you lie on the affected side. Weakness is another key symptom. Lifting your arm or doing everyday tasks like combing your hair can become difficult. You might notice limited range of motion. Maybe you can't lift your arm as high or reach behind your back. Some people feel clicking or popping when moving the shoulder. Ignoring these symptoms can make things worse. A small tear can grow larger if not addressed. Early recognition and action lead to better outcomes. If pain or weakness is persistent, don't just push through it. Let's talk about who's most at risk and how to prevent these injuries. Transition to next scene. Athletes in overhead sports, baseball, tennis, swimming, are at high risk for rotator cuff injuries due to repetitive motion. Older adults are also vulnerable, as tendons weaken and lose elasticity with age. Jobs involving overhead work or heavy lifting, like construction painting, add to the risk. Even repetitive arm movements in less strenuous jobs can contribute over time. Prevention starts with regular warm-ups and gentle stretches before activity. Strengthening the rotator cuff and upper back muscles provides better support for the shoulder. Always use proper technique in sports and lifting. Most importantly, listen to your body. Don't push through pain and allow for rest and recovery. Taking these steps can help keep your shoulders healthy for years to come. Now, what should you do if you suspect an injury? If you think you have a rotator cuff injury, start with rest and ice to reduce pain and swelling. Over-the-counter pain relievers can help, but avoid activities that make the pain worse. Gentle range of motion exercises like pendulum swings can prevent stiffness. Just don't push through sharp pain. If pain is severe, lasts more than a week or two, or you can't lift your arm, see a doctor. Sudden injuries with intense pain or loss of movement need prompt medical attention. Most rotator cuff injuries improve with physical therapy and conservative care. Surgery is only needed for severe cases. The key is early diagnosis and a tailored treatment plan. With patience and the right approach, most people recover well and return to their favorite activities. Take care of your shoulders. They're essential for an active, pain-free life.